Welcome to the Advancing Surgical Care podcast, brought to you by ASCA, the Ambulatory Surgery Center Association. ASCA represents the interests of outpatient surgery centers of every specialty and provides advocacy and resources to assist them in providing safe, high-quality, cost-effective patient care. As with all of ASCA's communications, please check to make sure you are listening to or viewing our most up-to-date podcasts and announcements.
Hello and welcome to the Advancing Surgical Care podcast. My name is Bill Prentice. I'm the Chief Executive Officer of the Ambulatory Surgery Center Association, or ASCA, and my guest today is Nina Goins. Nina became the Executive Director of the Ambulatory Surgery Center Quality Collaboration, or ASCQC, back in March of this year. Nina is an accomplished healthcare executive with over 25 years of experience with such notable companies as Regent Surgical Health, AmSurg, and Ardent Health, and she was chosen for this position because of that experience, as well as being a passionate advocate for maintaining the highest standards of quality and safety in the delivery of surgical care in surgery centers. Before we begin, I should also mention that in my capacity as the CEO of the ASCA Foundation, I also serve on the ASCQC Board of Directors. So with that introduction, Nina, welcome to the podcast.
Thank you.
So, Nina, I'm eager to talk with you about the work of the Quality Collaboration, particularly in helping surgery centers assess and improve the quality of the care they provide to patients. But before we do that, could you take a few minutes and share with our listeners some background about the Quality Collaboration, its mission, and its governance?
Certainly. We bring together leaders from across the ASC industry, associations like ASCA and AORN, accrediting organizations, management companies, state associations, and more, all united by one purpose, which is our mission to advance patient safety and quality of care in ASCs. We were founded around 2006 to develop and support standardized quality measures, and our vision is to serve as a resource for ASC quality and safety. As far as our governance goes, we're governed by a board of directors. We have an executive committee, a technical expert committee, and then several task forces that help drive our mission. I serve as the executive director, and Becky Ziegler-Otis is our assistant executive director. And Bill, I'll note that while the ASCQC and ASCA are separate entities, we work very closely as our missions are tightly aligned around delivering safe, high-quality care in ASCs.
Well, I can certainly second that. And the QC has been a great partner to ASCA and to the entire ASC community in terms of helping us to really make sure that surgery centers are focused on the right things. So I appreciate that support. So Nina, we need to take a short break to hear a few words from our podcast sponsor. Stand by and we'll be right back.
This recording of the Ambulatory Surgery Center Association is being brought to you by Surgery Partners, a leading operator of surgical facilities and ancillary services with more than 200 locations in 33 states. Surgery Partners offers multiple types of healthcare services that deliver high-quality healthcare in a convenient and cost-effective manner. To learn more, visit surgerypartners.com.
Nina, let's talk about the Quality Collaboration's ASC Quality Reporting Program. The Centers for Medicare and Medicaid Services, or CMS, currently requires surgery centers to report on 14 different quality measures to the government each year, or be penalized 2% of their reimbursements that they receive for providing care to Medicare beneficiaries. So, leaving aside the penalties, as I think everyone knows, ASCA generally supports these reporting requirements because they really helped policymakers, patients, and other payers see the high quality of care that's being provided by surgery centers today. And they also help individual surgery centers compare their results to other centers to learn where there's room to improve. So today, the Quality Collaboration has a quality assessment tool of its own. Can you explain to our listeners how this reporting tool differs from the government program and why we would encourage surgery centers to use it?
Yeah, that's a great question, Bill. And I will say many people don't realize that 6 of CMS's ASC quality reporting measures were actually developed and still maintained by Quality Collaboration. And as a measure developer, we're responsible for ongoing evaluation, like analyzing the data and ensuring the measures stay current and meaningful. Regarding our reporting tool, we collect data from our members quarterly. And that data represents over 2,000 centers and over 2.5 million encounters per quarter. And we publish those aggregate national results for 9 measures on our website. And that scale provides reliable longitudinal benchmarking, something centers can use to identify trends and drive improvement. And because our reports are published quarterly, centers don't have to wait the nearly 2 years like they do with CMS data. Gives them some real-time insight and support proactive improvement.
Nina, as you know, surgery centers have also been asked to voluntarily participate in a third-party quality reporting program, but surgery centers have not shown much interest in quality reporting that is not specifically tailored to their needs, and quite frankly, are simply too time-consuming or burdensome. Would you agree with that, and how can the QC help with that?
Yeah, I completely agree. We all know ASCs are deeply committed to safety and quality, but efficiency is key. That's exactly why the QC developed the Safety and Quality Assessment. And this is a concise 20-minute self-assessment covering safety and quality practices such as governance, quality improvement, infection prevention, and patient experience. Centers receive a dashboard report showing how they compare nationally, along with a certificate and a website badge to highlight their commitment to safety and quality. It's a credible ASC-specific quality comparison that can be used to build trust with patients, providers, and payers while reinforcing the ASC value story for all of us.
Are the results of that survey validated in any way? I mean, how can someone trust the results?
Yeah, that's a great point, Bill. We do have a validation process to ensure that we have valid, reliable data.
Great. So back to the tool itself. Can you also share with us the level of participation that you've seen recently with this new tool and the results of those reports so far, at least in the aggregate?
Yeah, for the Safety and Quality Assessment, this was our first year, and we were thrilled to receive nearly 400 submissions from various ASCs. And those results were overwhelmingly positive, strong safety and quality practices across the centers with only a few minor improvement opportunities. We plan to make this assessment an annual opportunity, and I encourage centers to participate each year. Even top performers benefit from tracking the results over time, and it's how we sustain quality.
So when each year will surgery centers have an opportunity to use this tool, and then when will results be shared with participants?
For 2026, our assessment will open May 1st and go through mid-June, giving centers a full 6 weeks to complete that. Then once it closes, we spend about 4 to 5 weeks validating the data, which I mentioned earlier, and preparing the dashboards with the national comparison, which are then mailed directly to participating centers. And I'll note that all submissions are strictly confidential. We do not publish any results. It's all about helping centers understand their performance, how it compares nationally, and identify improvement opportunities.
Well, that sounds like a great opportunity for a surgery center in a short 20-minute, half-hour time period to submit this data and get back some, I think, really powerful information to show how they're doing compared against others, as well as seeing if there's a place where they're falling short to know there's a place and an opportunity to improve. So I strongly encourage every surgery center to use this tool every year because in the aggregate, going to create some great data that we can use to advocate on behalf of surgery centers. Then obviously at the individual level, I think it's going to be really useful for benchmarking yourself against others and making sure you're continuing to do the right thing. So Nina, before I let you go though, I'd also like to give you a chance to talk about any other resources available from the Quality Collaboration that our surgery centers should be aware of that can help them out in terms of compliance or ensuring that they're providing a safe and high quality environment.
Yeah, we have lots of resources available on our website. The Quality Collaboration has developed about 9 practical toolkits that help centers strengthen safety and quality. One of our newest ones focuses on wrong site surgery prevention. It includes sample policies, checklists, training materials, and even FAQs. And then we have a resource page that has links to external resources for ease of convenience, like the ASCQR program, CAPS, Culture of Safety Survey, and even the accreditation. Our goal is to make it easy for ASCs to access that credible, ready-to-use information and tools that support continuous improvement.
That's awesome. Well, Nina, I want to thank you for spending some time with me today and for your exceptional leadership at the ASCQC. I know that surgery centers, patients, and payers are really better off today because of the work that you and Becky and the many volunteers that support the ASCQC do each day and help us to stay focused on delivering high quality healthcare. So thank you.
Thank you, Bill. It's truly been a pleasure. And the ASC community continues to set a high bar for safe, high quality care. And I'm really honored that the QC can help advance that. Thanks for having me.
Before I conclude, I'd also like to acknowledge the support of our Update sponsor, Surgery Partners, a leading operator of surgical facilities and ancillary services with more than 200 locations in 33 states. Surgery Partners offers multiple types of healthcare services that deliver high-quality healthcare in a convenient and cost-effective manner. To learn more, visit surgerypartners.com.